Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker with Terrebonne Home Care. Very glad you are joining us. However you may be joining us, we appreciate it very, very much. You know, we always like to bring you updates and give you updates, especially from the people who have that information. Welcome back to the program, Dr. Eric Brooks. He is with the Region 3 Medical Director. Thank you so much for joining us.
Thank you.
All right. We appreciate it. And look, one of these things that people are talking about, you know, we call it coming out of COVID, but COVID is still around. It still exists. And for us to kind of pretend like it doesn't is kind of silly. But let's talk about what we're really dealing with in our region.
Yeah, so absolutely. Yeah, so COVID is still around, and unfortunately it's not going anywhere.
Right.
Currently, the dominant strain that we're seeing here in Louisiana is something called BQ 1.1. That's
Okay.
around 40% of cases.
Okay.
That only accounts for about 27% within the U.S., though.
Okay.
We are seeing a new dominant strain start to come out of the Northeast.
Oh, okay. Wow.
Yeah. So the new strain that we're seeing, it's called XB 1.5. Like I said, it's currently prevalent in New York and the Northeast. It's accounting for about 75% of the cases over there. Overall, it accounts for about 40% within the U.S., so we are kind of starting to see some spread. That new variant's only about 22% currently in Louisiana.
Okay. So even though that we see this new strain, they migrate, right? They kind of spread. And so right now we're really seeing this BQ1. Is that something that came after this last variant that we talked about?
Yeah, so this XBB
Right.
1.5 is a new strain after the BQ 1.1.
Okay.
I know they're a little bit hard to keep track of.
Right,
They keep coming
right.
up with these new letters and numbers and things like that.
Right.
And with the emergence of XB 1.5, they did see an increase in hospitalizations in New York.
Oh, wow.
But it wasn't because it was a more severe disease. It wasn't anything out of proportion to previous recent strains that they've had. It's just with this new variant, XBB 1.5, one of the main mutations it has is it does help it kind of hide and avoid some of that immunity that we may have developed with previous strains.
Okay, wow. And so it's just one of those things that kind of echoes the importance of being vaccinated. It's just one of those things, right?
It does. One thing to remember, and it's one of the points I was going to make, being vaccinated, even though some of these strains are kind of adapting and mutating these abilities to avoid our immune systems or immunities that we've developed with previous strains, prior vaccinations, especially with the new updated bivalent boosters, is very good evidence to show that it does prevent severe disease. So it can prevent that hospitalization or prevent that death.
Right, and that's just one of those things. You know, we know a lot of people are saying, oh, it's only like cold symptoms. It's not as bad as even the two types of flu that's going around. Well, the whole point is that if you're not vaccinated, you have a much higher chance of going into the hospital. And then there's so many other problems that can arise.
Very true. And even if you're not one in that high-risk group and you do just get a runny nose, you get tired for a couple days, you may be symptomatic, you may be contagious prior to those symptoms. And if you're around somebody that's elderly or somebody that is high risk, even though you're okay, that high-risk individual may end up in the hospital or ultimately end up dying from an infection.
Right, and that's one of the things that we want to avoid. We want to avoid those things. But we still need to kind of be aware of how we prevent the spread of the illness. And I appreciate that y'all focus on that and some really great reminders about how we can prevent the spread of COVID.
Yeah, no, absolutely. It's very good. And number one is vaccinations. Always can be vaccination. Right now, we're recommending everybody 5 years and up is eligible for a booster, the updated bivalent boosters.
Okay.
And of course, in addition to that, hand washing, masking, social distancing, all those things are very important reminders. And don't assume just because you've had a negative test, if you have cold or flu-like symptoms, there have been reports of what we call false negative tests, or when you have COVID and you do those at-home tests. They're fairly accurate, but sometimes they can give you a false sense of security. Mm-hmm. So it is important to remember it could be COVID. You still need to socially distance yourself, quarantine, especially from those that are high risk.
Yeah, and one of the things that we're seeing in a lot of our facilities, it's just one of those things. I am with my job, in and out of facilities, in and out of physician offices, in and out of the hospital, keep a mask with you because you're not sure where you may need to do that or if you'll develop some symptoms. Some of us, with all these weather changes, wake up with kind of a head cold sometimes or feeling that. Have a mask with you, keep other people safe.
Absolutely. And to that point, too, even if you don't have symptoms, if you're around somebody who doesn't have a mask or does have a mask, but you notice they have symptoms too, if both of you are wearing masks, or at least you're wearing a mask, that does decrease your chances of getting COVID also.
Okay. Some other recommendations, Doctor, you have for prevention?
That's really, it hits all of them. If you have a choice between indoor and outdoor activities and groups, choose the outdoor activities. That's going to keep you a little bit safer, but hand washing, avoiding close contact, wearing a mask, stay home if you're sick. Like I said, not just a negative COVID test, but if you're feeling sick, if you feel like you have cold or flu-like symptoms, don't really rely on that negative COVID test.
And it's really happened to several family members, 3 family members of mine here of recent. If you have a chance to drive versus fly, drive. And I say that because my brother-in-law gets COVID most often when he flies, and we'll believe that my parents here just in the last couple of weeks got COVID not because they flew, but they got it because they were exposed to more people through the airport. And so that's something that can happen. Well, Dr. Brooks, we always appreciate the work that you guys are doing, keeping us safe. And over at the Office of Public Health, that is your position and job to really look after what the community needs. So thank you and your team very, very much for really looking into what's continuing to be an issue and how we can maybe prevent that. We appreciate it very, very much.
Thank you. Thank you for your time.
Absolutely. All right, guys. Well, we appreciate that. Thanks for all of the people working in public health and keeping us safe. And we're going to take a short break. Don't go anywhere. A lot more Bayou time when we continue.